Question 1. A pathologist performs a gross and microscopic examination of a gallbladder specimen removed for cholecystitis, inflammation. Which CPT code should be reported for this service? A. 88302. B. 88304. C. 88305. D. 88307. Answer: B. 88304. This question tests your ability to select the correct surgical pathology code based on the specimen type. The key clue is the gallbladder specimen, which is explicitly listed as a Level 3 service in the CPT codebook. Code 88304 represents Level 3 gross and microscopic pathology procedures. For example, a gallbladder, appendix, or fallopian tube for sterilization are all common examples that fall under this code. Remember to always check the specimen list for each pathology level, 88302 to 88309, to ensure you are coding correctly. Question 2. A pathologist performs a qualitative immunoassay for a single drug class using a dipstick method to screen a urine sample. Which code is most appropriate for this service? A. 80305. B. 80306. C. 80307. D. 80320. Answer: A. 80305. This scenario tests your knowledge of presumptive drug testing codes, which are used for initial screening. The keywords qualitative immunoassay, dipstick method, and screen point to a simple, non-instrumented test. Code 80305 describes a drug test, presumptive, by any method that is read by direct optical observation only, like a test cup or dipstick. In contrast, 80307 is used for instrumented screening, and codes like 80320 are for definitive, confirmatory, testing. Think of it this way: if the result can be read directly with the eyes without a machine, it's likely a presumptive, non-instrumented test. Question 3. During a mastectomy for cancer, the surgeon removes a sentinel lymph node and sends it to the pathology lab for immediate intraoperative examination to determine if cancer has spread. The pathologist prepares and examines the frozen section and provides a rapid diagnosis back to the surgeon. What CPT code reports the pathologist's service for the frozen section? A. 88305. B. 88331. C. 88307. D. 88333. Answer: B. 88331. This question is about coding for intraoperative consultations, specifically a frozen section. The key phrase immediate intraoperative examination signals that a rapid diagnosis is needed while the patient is still in surgery. Code 88331 is used to report the first frozen section performed on a single specimen during a surgical procedure. For instance, if the surgeon needs to know if a tumor margin is clear before closing, a frozen section provides that answer quickly. Always remember that 88331 is an add-on procedure and is reported in addition to the primary surgical pathology code for the main specimen. Question 4. A pathologist receives a bone marrow biopsy that is too calcified for sectioning. The laboratory technician must perform a decalcification procedure before the specimen can be processed for microscopic examination. Which code reports the decalcification service? A. 88309. B. 88311. C. 88312. D. 88342. Answer: B. 88311. The concept tested here is the coding for special services performed in the pathology lab that are not included in the standard gross and microscopic exam codes. The term decalcification procedure is the direct clue, as this process is required to soften bone or other calcified tissue for analysis. CPT code 88311 is designated specifically for this decalcification process and is reported in addition to the primary surgical pathology code, e.g., 88305 for the bone marrow biopsy itself. Think of decalcification as a necessary preparatory step that requires its own code because of the extra work involved. Question 5. A pathologist at Hospital A is asked to provide a second opinion on a complex tumor case originally diagnosed at Hospital B. The pathologist reviews the microscopic slides, patient's medical history, and relevant lab data from Hospital B to provide a comprehensive consultative report. Which CPT code best describes this service? A. 88321. B. 88323. C. 88325. D. 88309. Answer: C. 88325. This question tests the coding for pathology consultations on material from an outside source. The key information is that the pathologist performed a comprehensive review, including microscopic slides, patient's medical history, and relevant lab data. This level of work is captured by code 88325, which is for a comprehensive consultation that includes reviewing records and providing a detailed report. Simpler consultations, like just reviewing slides, 88321, or reviewing slides and a brief report, 88323, would not be appropriate for this extensive service. A helpful tip is to match the level of documented work in the consultation report to the requirements of the consultation CPT codes. Question 6. A patient undergoes a fine needle aspiration, FNA, of a thyroid nodule, performed by a radiologist. The pathologist is present, performs an immediate evaluation of the slides to ensure the sample is adequate for diagnosis, and later provides a final interpretation. Which CPT code should the pathologist report? A. 10021. B. 88172. C. 88173. D. 88305. Answer: C. 88173. This scenario assesses your knowledge of coding for the evaluation of a fine needle aspiration, FNA, specimen. The key services performed by the pathologist are the immediate evaluation for adequacy and the final interpretation. CPT code 88173 is used to report the pathologist's interpretation and report of an FNA, and it includes the service of assessing specimen adequacy if performed. Code 10021 would be reported by the physician performing the actual aspiration procedure, not the pathologist evaluating the sample. A simple way to remember is that 88173 is for the pathologist's analysis, not the physical act of obtaining the sample. Question 7. A physician orders a comprehensive metabolic panel, CMP. The laboratory performs all 14 required tests. Which CPT code should be used for this service? A. 80048. B. 80053. C. 80061. D. Billing each of the 14 tests individually. Answer: B. 80053. This question is about understanding and correctly coding for defined organ or disease-oriented panels in the clinical laboratory section. The keyword comprehensive metabolic panel directly corresponds to a specific CPT code that bundles all the included tests. Code 80053 represents the CMP, which includes 14 specific chemistry tests like glucose, calcium, and liver enzymes. It is incorrect to unbundle and bill for each test separately when a panel code exists that describes the service performed. Always remember that if a defined panel is ordered and all its components are performed, you must use the single panel code. Question 8. A pathologist examines a skin biopsy for a blistering skin disease and performs a direct immunofluorescence test using 3 separate antibodies on the tissue. How should this service be coded? A. 88,346. B. 88,350. C. 88346, 88,350x2. D. 88,342. Answer: C. 88346, 88,350x2. This question tests the correct coding for immunofluorescence, a special staining technique. The clue is direct immunofluorescence test using 3 separate antibodies. CPT code 88346 reports the initial single antibody immunofluorescence stain, while the add-on code 88350 is used for each additional antibody stain performed on the same specimen. Therefore, the first antibody is coded with 88346, and the next 2 are coded with 88,350 reported twice. Think of 88,346 as the base code for the first stain, and 88,350 as the code for each additional one after that. Question 9. A patient with suspected fungal pneumonia has a lung biopsy. The pathologist examines the standard H-Anni stain slide but also orders a special stain, a gaumery methenamine silver, GMS, to specifically identify fungal organisms. What CPT code reports the GMS stain? A. 88,305. B. 88,312. C. 88,313. D. 88,342. Answer: B. 88312. The concept here is distinguishing between standard stains included in a surgical pathology service and separately billable special stains. The keywords special stain and GMS, gaumery methenamine silver, are crucial, as GMS is used to detect fungi and is not a routine stain. Code 88312 is used for special stains for microorganisms, such as the GMS stain. This is reported in addition to the surgical pathology code, e.g., 88305 for the lung biopsy. Remember, if the pathology report mentions a specific stain by name, like GMS, PAS, or trichrome, to look for something specific beyond the basic cell structure, it's likely a separately reportable special stain. Question 10. A pathologist interprets the results of a complete blood count, CBC, with an automated differential white blood cell count performed at a local clinic's laboratory. The pathologist is not an employee of the clinic and provides only the interpretation. Which CPT code and modifier would be reported for the pathologist's service? A. 85,025. B. 85,027. C. 85,025 to 26. D. 85027 TC. Answer: C. 85,025 to 26. This question combines knowledge of hematology codes and the use of modifiers for professional services. The key elements are CBC with an automated differential and the fact that the pathologist provided only the interpretation. Code 85025 represents a CBC with an automated differential, and modifier 26, professional component, is appended to indicate that only the physician's interpretation work is being billed, not the technical work of running the test. The clinic that owns the machine and ran the sample would bill 85025 TC for the technical component. A great tip is to use modifier 26 whenever a physician interprets a test but does not perform the technical part of it. Question 11. A breast biopsy specimen is sent for pathology. The pathologist performs an immunohistochemistry, IHC, stain for the estrogen receptor, ER, protein. Which CPT code reports this single antibody stain? A. 88,313. B. 88,341. C. 88,342. D. 88,360. Answer: C. 88342. The focus of this question is on coding for immunohistochemistry, IHC, a common ancillary test in pathology. The keywords are immunohistochemistry, IHC, stain, and single antibody, in this case, for ER. CPT code 88342 is used to report the first single antibody IHC stain performed on a specimen. If additional antibodies were tested, for example, progesterone receptor, the add-on code 88341 would be used for each subsequent stain. For beginners, remember that 88342 is the base code for the first IHC stain in a case. Question 12. A patient with diabetes has his glucose level tested in the morning. Due to a critically high result, the physician orders a repeat glucose test on the same patient 4 hours later on the same day to monitor the effect of insulin treatment. How should the laboratory report the second glucose test? A. 82,947. B. 82,947 to 76. C. 82,947 to 59. D. 82,947 to 91. Answer: D. 82,947 to 91. This question tests the correct use of modifiers for repeated laboratory tests. The key information is that the same test, glucose test, was performed on the same day but at a different time for reasons of medical necessity, to monitor the effect of treatment. Modifier 91, repeat clinical diagnostic laboratory test, is specifically designed for this situation, indicating that a subsequent test was a repeat of the same test on the same day to obtain new information. Modifier 76, repeat procedure by same physician, is used for procedures, not typically for clinical lab tests in this context. A good way to remember is that modifier 91 is your go-to for medically necessary repeat lab tests on the same day. Question 13. A pathologist performs a gross examination only on an orthopedic screw that was removed from a patient's ankle. No microscopic examination is performed. Which CPT code should be reported? A. 88,300. B. 88,302. C. 88,304. D. This service is not billable. Answer: A. 88300. This question assesses your understanding of the lowest level of surgical pathology service. The defining clue is gross examination only, meaning the pathologist looked at the specimen with the naked eye but did not prepare slides for microscopic review. CPT code 88300 is specifically for Level 1 surgical pathology, which involves gross examination only. This code is often used for specimens like foreign bodies, hardware like this orthopedic screw, or teeth submitted for identification. Remember, if there's no microscopic exam, you should immediately think of code 88300. Question 14. A pathologist at a reference lab receives a breast cancer specimen to perform fluorescence in situ hybridization, FISH, to assess for HER2 gene amplification. The service includes the technologist's work scanning for 10 to 20 cells and the pathologist's interpretation. Which CPT code should be reported? A. 88,342. B. 88,365. C. 88,367. D. 88,369. Answer: B. 88365. This question tests your ability to code for in situ hybridization, ISH, a molecular pathology technique. The keywords fluorescence, in situ hybridization, FISH, and gene amplification point directly to the morphometric analysis codes. CPT code 88365 is used for the initial single-probe ISH analysis, such as testing for the HER2 gene. This is different from immunohistochemistry, IHC, which tests for proteins, like code 88342. To keep them straight, remember that ISH/FISH 88365 looks at genes or DNA, while IHC 88342 looks at proteins. Question 15. A physician orders a lipid panel for a patient. The lab report includes results for cholesterol, triglycerides, HDL cholesterol, and LDL cholesterol. Which CPT code should the laboratory report? A. 80053. B. 80061. C. 82465, 84478, 83718. D. 83721. Answer: B. 80061. This question is about correctly identifying and using CPT codes for laboratory panels. The key clue is the lipid panel and the listed components: cholesterol, triglycerides, HDL, LDL, which are the exact components of the panel defined in the CPT codebook. Code 80061 represents the lipid panel and bundles these specific tests together. It is incorrect to report the individual component codes when a specific panel code exists and all its components were performed. A helpful tip is to familiarize yourself with the common laboratory panels like the lipid panel, 80061, basic metabolic panel, 80048, and comprehensive metabolic panel, 80053. Question 16. A patient has two distinct skin lesions removed from different body sites, a mole from the back and a cyst from the arm. They are placed in separate, labeled containers and sent to pathology. The pathologist performs a gross and microscopic examination on both. The mole is coded with 88305 and the cyst with 88304. How should these codes be reported? A. 88305. B. 88305, 88304-59. C. 88305x2. D. 88309. Answer: B. 88305, 88304-59. This scenario tests the coding principle for multiple, distinct pathology specimens from the same patient encounter. The key information is that there are two distinct lesions from different body sites and in separate, labeled containers. Each specimen is evaluated individually and assigned its own surgical pathology code based on what it is. Mole equals 88305, cyst equals 88304. Modifier 59, distinct procedural service, is appended to the second code to indicate that it was a separate specimen from a different site and not a duplicate service. Think of each separately identified and containerized specimen as its own distinct service deserving its own code. Question 17. A renal biopsy is sent for examination with an electron microscope to evaluate for kidney disease. Which CPT code is used for the pathologist's electron microscopy service? A. 88307. B. 88342. C. 88348. D. 88360. Answer: C. 88348. The concept being tested is coding for highly specialized pathology procedures. The keyword electron microscope is the direct giveaway for this question, as this technique is distinct from standard light microscopy. CPT code 88348 is specifically designated for electron microscopy diagnostic services. This procedure provides ultramagnification to see cellular structures not visible with a regular microscope, often used for diagnosing kidney diseases, tumors, and certain infections. If you see electron microscopy in a report, your mind should jump directly to code 88348. Question 18. A physician orders a basic metabolic panel, BMP, which includes a glucose test. However, the physician also wants a separate, stat glucose test performed at the same time from the same blood draw. How should the lab code for these services? A. 80,048 only. B. 80048 and 82,947 to 59. C. 82947 plus the other 7 components of the BMP billed individually. D. 80048 and 82947. Answer: B. 80048 and 82,947 to 59. This question tests the rule about billing for a test that is also part of a panel performed during the same encounter. The key is that the physician ordered both the basic metabolic panel, 80048, and a separate, stat glucose test. Because the glucose test was specifically ordered as a separate item, it can be reported in addition to the panel, but it requires modifier 59 to indicate it was a distinct service from the glucose test included within the panel. For example, the stat glucose was needed for immediate decision-making, separate from the routine panel results. Remember, you can only unbundle a test from a panel if it was distinctly ordered and medically necessary. Question 19. A surgeon removes a colon segment for a tumor. The pathologist examines the specimen, which includes evaluating the tumor and the surgical margins. This type of complex organ resection is classified as which level of surgical pathology? A. 88,304. B. 88,305. C. 88,307. D. 88,309. Answer: D. 88309. This question asks you to identify the highest level of surgical pathology based on specimen complexity. A colon segment for a tumor is a classic example of a complex specimen requiring extensive work, including evaluation of the tumor, lymph nodes, and surgical margins. CPT code 88309 represents level 6, the most complex level of surgical pathology, and is reserved for the examination of total or major organ resections. A simple tip is to associate level 6, 88309, with large, complex cancer resections like a colon, lung, or total mastectomy. Question 20. A Pap test specimen is processed using an automated thin layer preparation method. It is first screened by an automated system and then involves manual screening by a cytotechnologist. Which CPT code should be reported? A. 88,142. B. 88,150. C. 88,164. D. 88,175. Answer: D. 88175. This question is about correctly coding for cervical or vaginal cytopathology, Pap tests, based on the technology used. The key phrases are automated thin layer preparation and screened by an automated system and then involves manual screening. CPT code 88175 specifically describes a Pap test that combines automated system screening with subsequent manual review by a technologist. This is different from a purely manual screen, 88150, or a conventional smear, 88164. Always pay close attention to the method of preparation and screening described in the report to select the correct Pap test code. Question 21. A patient provides a urine specimen that is sent to the lab for culture. The culture is positive for bacteria. The lab then performs additional tests to identify the specific type of organism, e.g., E. coli. Which CPT code describes the definitive identification of the bacterium? A. 87,040. B. 87,077. C. 87086. D. 87184. Answer: B. 87077. This question tests your knowledge of microbiology coding, specifically the difference between a culture and organism identification. The keyword is identify the specific type of organism, which indicates a definitive identification was performed after the initial culture grew bacteria. Code 87077 is used for the culture of aerobic bacteria, with isolation and definitive identification of each organism. Codes like 87086 are for presumptive screening cultures only, and 87040 is for a stool culture. A helpful way to think about it is that the culture, seeing if something grows, and the identification, figuring out exactly what grew, are distinct steps in the process, often bundled into a single code like 87077. Question 22. A pathologist at University Hospital receives slides from a patient's appendix specimen that was processed at a local community hospital. The pathologist at University Hospital is asked only to review the slides and confirm the diagnosis of appendicitis. Which CPT code should be used for this consultation service? A. 88304. B. 88321. C. 88323. D. 88325. Answer: B. 88321. The concept tested here is selecting the correct level for an outside pathology consultation. The key information is that the pathologist will review the slides and confirm the diagnosis, which is a straightforward, limited service. CPT code 88321 is defined as a consultation and report on referred slides prepared elsewhere, representing the most basic level of pathology consultation. This differs from more complex consultations that involve reviewing records, 88325, or writing a more detailed report, 88323. When the service is simply a second look at slides from another facility, 88321 is the appropriate code. Question 23. A molecular pathology lab performs a genomic sequencing procedure that analyzes 10 specific genes known to be associated with a patient's type of cancer. This type of multi-gene panel is categorized under which coding methodology? A. Tier 1 molecular pathology procedures. B. Tier 2 molecular pathology procedures. C. Genomic sequencing procedures. D. Unlisted chemistry procedure. Answer: C. Genomic sequencing procedures. This question covers the coding structure for modern molecular pathology tests. The keywords genomic sequencing procedure and multi-gene panel point you away from the older Tier 1 and Tier 2 codes, which typically cover single-gene analyses. The genomic sequencing procedure, GSP, codes were introduced to more accurately report on next-generation sequencing, NGS, panels that analyze multiple genes at once. Therefore, when you see a test described as an NGS panel or a genomic sequencing panel, you should look in the GSP section of CPT. Question 24. A pathologist uses flow cytometry to analyze cell surface markers on a bone marrow aspirate to diagnose leukemia. The analysis includes 12 markers. How is this service typically coded? A. A single code for the entire panel. B. One code for the first marker, and an add-on code for the 11 additional markers. C. One code that covers up to 8 markers, and a second code for the remaining 4. D. One code for the professional component and one for the technical component. Answer: B. One code for the first marker, and an add-on code for the 11 additional markers. This question tests the coding convention for flow cytometry, a technique used to analyze cell characteristics. The key concept for coding flow cytometry is that it is billed per marker. CPT code 88184 is used for the first marker, An add-on code 88185 is reported for each additional marker analyzed. In this case with 12 markers, the coding would be 88184 for the first one and 88,185 11 times for the others. Think of it like this: each marker is a separate test, so you report a code for each one you evaluate after the first. Question 25. A pathologist is performing a microscopic examination on a prostate biopsy. To better visualize the tissue architecture and identify potential cancer, a special stain known as an H&E stain is used. How is the H&E stain coded? A. 88,312. B. 88,313. C. It is not separately reportable. D. 88,342. Answer: C. It is not separately reportable. This question tests a fundamental principle of surgical pathology coding, understanding what is included in the base service. The key term is H&E stain, which stands for hematoxylin and eosin, the standard, routine stain used for virtually all surgical pathology specimens. The work of performing an H&E stain is considered an integral part of the surgical pathology codes, 88,300 to 88,309, and is not billed separately. Unlike special stains, 88312, 88313, or immunohistochemistry, 88,342, the H&E stain is the default and is always included. A good rule of thumb is that if a stain isn't specifically listed as special or by a unique name, like PAS or GMS, it's likely the included H&E stain.